Well, we can go ahead and get started if you all would like. And thank you for coming out and being inside when it's like really ready to go swimming in the swimming pool sort of weather. Except it would probably be extremely cold going in and being in a pool right now. Then what I had done last month was gave a presentation on ADD or ADHD, basically ADD, where part of what we'll go over today, and I want to make sure that I'm kind of, I don't know if I'm in the right spot. We have this little camera up here, and I'm going to not have to wander off too much. Then last month when I was talking about this, then the whole issue of ADD and ADHD can be very confusing. Basically from the standpoint that it has several different names. So part of what doctors will do, psychiatrists especially, is we will get together every once in a while, usually every, say, 10, 12, 15 years, and kind of come up with new names for things. Not intentionally where we just come up with new names to drive everyone bananas, but just say, oh, well, maybe this would be a better description for this kind of set of difficulties. So what happened many years ago was that ADD or ADHD symptoms were called minimal brain dysfunction. It then became ADD and ADHD. Then up until about probably several months ago, it was described as, all of it was ADHD. It was all called attention deficit hyperactivity disorder. And then there were 3 different types, at least according to the American Psychiatric Association.
And those were the inattentive type, where it was basically someone just had attention difficulties. Well, not just. I mean, all these things that would cause difficulties with how they would function. Other individuals would just have the hyperactive and impulsive type, where they might have some attention issues, but not severely, but mostly it was they couldn't sit still well. They were more impulsive. They had both a lot of physical energy as well as a lot of verbal energy, and just full of energy and always on the go and super on the drive. And the third type was the combined type, where individuals had all of these kinds of symptoms together, where they had both the attention issues as well as the difficulties with hyperactivity and impulsivity. Well, the thing that was going on, at least with regards to Dr. Amen's work, was that as these were changing over time, he was also finding that with evaluating individuals with these kinds of symptoms, there also seemed to be other categories that would fit. That some individuals would have what we typically thought of as ADD or ADHD kinds of problems, and the part of the brain that was involved. So the part of the brain that seems to be most important, according to most individuals and according to pharmaceutical companies, the companies that make the medications that help with this, is the frontal lobe. Now, in many ways that makes sense. It's like the frontal lobe, front part of the brain. If we're looking at the brain kind of on these scans, it's right up here, right behind the forehead. This part of the brain is involved in things like attention, concentration, and focus. So if it's not working well, we can have difficulties with things like getting distracted easily, mind wandering off, being daydreamy. It also handles what we call the executive functions of the brain. So if we think about what does an executive in a company do? Well, they're involved in the planning, organization, and follow-through on what needs to happen to run a company well. So if we say, okay, this is maybe an adolescent, it's like, what would happen if they had executive functioning problems? Well, they couldn't plan, organize, or follow through on things, much like someone who needs to run a company. They just can't do that well to get homework and other things done. So this part of the brain, if it's not working, can lead to a lot of attention difficulties. It's also the part of the brain that puts the brakes on both our actions and emotions. So a person might have more difficulties with stopping and thinking first, not being fidgety, not getting up out of their seat, blurting things out without raising their hand. So all those ADHD kinds of problems. But what Dr. Amen also found was, gee, that doesn't seem to be the only kind of thing that's going on. That some individuals might get very distracted in things that they're not really all that interested in, but things that they are interested in, they get intensely focused on, they're stuck on, and you can't seem to pry these kids' attention away from it. Other individuals, it might be that they have learning difficulties or problems in what's called the temporal lobes that are involved in learning and memory. They might have difficulties with anxiety, difficulties with depression, could be difficulties with just very intense and explosive kinds of emotions in all sorts of ways. So it's like, gee, here's all these different kinds of individuals. We all call them as maybe just ADD, as just having attention issues, if we're looking at it from a psychiatric standpoint. But if we look at it in terms of what their brain is doing, there's all sorts of different things that might be going on. So the way I came about this was in a slightly different way, that it was looking at what else is going on inside a person's body. And what happens, and this is kind of where it came up, and it's actually an international sort of issue, and something that's been looked at internationally, is that different individuals as investigators are finding, much like Dr. Amen has found, that there can be a number of things that can cause difficulties with these kinds of symptoms with attention. And here's the most important thing, and then we'll start through the slides. That part of what happens for individuals who are psychiatrists is that we all go to medical school first. And there's a reason for that. What we as psychiatrists should do is that part of evaluating what's going on for a person, either cognitively in terms of thinking, concentrating, getting things done, or emotionally, is that we should consider not only what category does a person fit into, but could there be a medical explanation for why a person is having these kinds of difficulties? Because if there is, we should correct that. Rather than saying, well, gee, you have to be on this medication, maybe you have to be on it for months or years or decades. If there's a medical reason that someone's having difficulties, we should correct that, because that may help to remove either the need for medication or even remove the symptoms. So that's why this I put together as, if we're looking just at the attention issues, not so much hyperactivity, but all this still applies. If we're just looking at ADD issues, this is looking at what could we do either with medications or even completely without them to take care of this kind of problem or sets of problems. So with regards to ADD, it goes by all sorts of different names, kind of things that we talked about a bit, like if it's ADHD, predominantly inattentive presentation, that's the new term. That's DSM-5. It's now not ADHD, predominantly inattentive type, it's predominantly inattentive presentation. So this is, as you see up here, this is typically what's determined by having a psychiatrist or physician or counselor perform a psychiatric evaluation where it's looking at, do they fit into certain criteria. ADD is typically determined by a pediatrician or family medical physician. Now, what does this involve? Well, this is sort of like, what happens is, if you go into a pediatrician's office, they don't have an hour to sit down with family typically, to review how are things at school, how are things at home, do you fit all of these criteria in terms of having an attention problem, and not just do you get distracted some, but do you have difficulties with regards to a number of things. So they often, very wisely, have individuals fill out questionnaires. They'll have parents fill those out, teachers fill them out, sometimes adolescents fill those out. They'll look at, okay, are there enough attention difficulties that's creating a problem? Is that going on in several different environments? Are they meeting, not just getting distracted, but they're losing things, forgetful, all these kinds of things. And here's what can happen, because I've experienced this. You go in, and after everyone's filled out those questionnaires, if someone has 4 out of 9 different kinds of symptoms related to attention problems, they don't have ADD. Because there's a threshold. You have to have like 6 out of 9 different kinds of problems. And we'll go over this in a moment. So if you don't quite have that, they'll say, well, you can connect with a counselor, or work more on study skills, or all kinds of things, where what can then happen is that a person just becomes frustrated, or additional treatment kind of gets delayed because it's not quite meeting what then the doctor would say, okay, we need to do something about this right now. Other than some counseling, other things that may take a while, which are definitely good things to do. I don't want to minimize that. But it may delay getting thorough treatment for it. And then the other approach that we can take is getting a SPECT scan done, where what is happening is, like with the evaluations that we do here, It's looking at not only what symptoms does a person have when they're talking with either a psychiatrist or historian or counselor, but what is their brain actually doing when we look at how it's functioning. And for ADD, the traditional ADD, type 1 that Dr. Amen describes, is this combined type. It's both the hyperactivity and the attention problem. So just the attention issues could be any of these particular types. All sorts of things that might be going on in terms of how a person's brain is functioning. So a lot of different names. So when I was preparing earlier this week and over the weekend looking at, okay, well, what are the new criteria for ADD according to the American Psychiatric Association? It's now turned into a mess, in my opinion. And now, here's the reason why. Used to be, so as you're kind of looking at this, all of this stuff over on the left-hand side of the screen here are all the same symptoms. And what happens is, historically, up until several months ago, you had to have 6 out of 9 of those things occurring frequently, where it was creating difficulties. It's like, you know, we all get distracted. If we're bored, we're kind of forgetful, or we're not paying the greatest attention, our mind wanders off. Those are normal things. But if that's happening often and frequently and causing problems with getting the kinds of grades that we should get, then that is a big difference than just kind of our mind wandering off when we're bored occasionally. So we'd have to have like 6 out of 9 of those things. And it would have to start before age 7. That individuals would, it wasn't like, oh, this only kind of started once I got depression when I was a teenager, and then it started causing all these attention issues as well. And what's happened is that now there have been all these additions. Well, it's always been, you know, that it interferes with functioning, but now it's kind of, well, it's not that it has to necessarily interfere with functioning to the point where it's a problem. It just has to lessen how well you could do if you didn't have those symptoms. Well, that becomes very subjective. So it's sort of like, well, if I didn't have these attention problems, I could get an A instead of a B+. So then my concern is, okay, how many individuals coming in with B+ grades in high school are like, well, I need to be on a medication for this. So my concern is it kind of opens up that door. Symptoms have to be present before age 12. So in other words, you have to have several symptoms, but it doesn't necessarily have to be causing problems until age 12 or slightly before. So you could basically now go through most of elementary school with a few difficulties, and as long as it wasn't too bad that you get diagnosed with ADD even as you get older. So it kind of widens the gap in terms of when things can show up. And then if you're 17 or older, because some of these things kind of calm down over time, you only have to have 5 out of 9 of these. So if I were a pediatrician and had maybe 15 minutes to meet with a family, there's no way I could remember all this. It's like, oh my Lord. And, you know, filling out all sorts of questionnaires. Even with the questionnaires, it's reviewing all of those, it's talking with the family, doing the physical examination. Maybe even half an hour isn't going to be enough time. And it can get dizzying in terms of how often we as physicians, and who knows what this will be in another 10 years. So I'm like, okay. So that's where things are at least according to the American Psychiatric Association. Now, who is the best person to determine if you have an attention difficulty or a task completion problem? You are. Now, why do I say that? It's like, okay, well, geez, this guy just opened up the door to everybody wanting a medication. Well, most individuals would rather not take stimulants. I mean, some people in college would, and they figure, like, I can stay up, I can study for like 14 hours a day, I can be up all night, you know, and get great grades the next day. Most individuals would rather not be on medication. Some would, and that's something we need to be cautious of, but if we're looking at individuals who have memory difficulties, we have all these tests for those memory problems. We can evaluate, does someone have problems with what's going on with these? And what has happened is that it seems like the best indicator of who eventually develops difficulties with memory sorts of issues or has what we call mild cognitive impairment, it hasn't really been best determined by different tests that doctors come up with. It's a person who comes in and says, you know what, I'm concerned about my memory. That seems to be the best indicator of who might have developing difficulties with regards to memory problems is the person who comes in and says, I'm concerned, rather than the doctor says, oh, I did this test and you have some difficulties with your memory, you should watch for this. Now, the best person is really the individual, where they're most familiar with what they need to be able to do in life and able to get things done. And if that isn't working well, then that's the precise person that we should listen to as medical providers, or as counselors, or as therapists, or as parents. As a consequence, it is part of my job to figure out, okay, is this causing enough problem before, especially if I do something to prescribe a medication to intervene. But mostly it's to figure out, okay, why is a person having these difficulties, and then what to do about them. So it's a circumstance where basically I don't expect a person to come in and say, you know, I've read all the books, I've reviewed the American Psychiatric Association's Diagnostic and Statistical Manual, that I've gone through all these criteria and online questionnaires and Dr. Amen's questionnaires and all this other stuff. What I'm happy doing, and as part of my job, is if someone comes in and says, you know what, I feel like I've got these attention problems, that we then sit down, I sort out, along with that person, is it causing problems in their life? What category or situation does it fit into, and then what do we do about that? So it's more an individual shouldn't have to feel like they need to come in with their diagnosis all set. That's part of what we do together. So if we look at medications, so let's just say, because part of this when I started out was, okay, we're going to look at what can we do in terms of treating ADD with or without medications. So what do medications do? So this is something that we get a whole lot in medical school, mostly in psychiatry, and this is basically an image of what happens chemically within the brain, what we think happens. So what we see here, over here on your left, this is one of the brain cells, and this is a second brain cell here. So if we're looking at things like whether it's up here in the frontal lobe or other parts of the brain, it's like what happens with the brain, the one cell on the left electrically sends a message down that particular cell. When it gets to the end where these little circles are, this message sends out these chemicals in these little bags here. They go across where these little purple arrows are, and they fit into what are called these receptors here, where it sends a message to the next brain cell. So basically what happens is brain cells send messages down them individually electronically, but they talk to each other chemically. Now, what we assume happens is that there's certain chemicals, like dopamine is one chemical in the brain, adrenaline is another, that goes from this brain cell over the next one, and basically what it tells the next brain cell is something like, sit still, pay attention, get your work done. So then we say, oh, well, if that isn't working well, it must just be that there's not enough of those chemicals saying, sit still, pay attention, get your work done. That's the assumption that we make. And it's those two chemicals, so we come up with all sorts of different medications that basically either improve how well dopamine or adrenaline get to this next brain cell. So when we do that, when we prescribe a medication for somebody, we're making all sorts of assumptions. One is that we assume that these chemicals are working and they're really helping this front part of the brain take care of these chemicals working well. Well, that's a rather big assumption because it isn't true. That in other words, if you take a medication, it just doesn't go to one part of your brain and it doesn't mess with anything else. That there's other parts of the brain that are involved in sleep, and if you stimulate them, the person's not going to sleep well. Or if you stimulate other parts of the brain that are involved in appetite, you're not going to be as hungry. So you can get all these side effects. And it's not necessarily that some of these medications, like stimulants, work in just one part of the brain and not another, or equally. So you can get all sorts of difficulties that might come up. The other thing is that it's presuming that these little sacks of chemicals are full. And that all we need to do with medications is, as these chemicals are coming out here, we just need to, with most medicines, what they do is they block these things right here, these little receptors that take these chemicals that aren't used and take them back up into this previous brain cell. So it's sort of like there's a recycling going on. The chemicals that aren't work go back here so they can be used again. Well, I know what we can do. Well, most medicines, like for depression, what we have and often use are what are called serotonin-specific reuptake inhibitors, or serotonin-selective SSRIs. So it's basically we block this reuptake or block this recycling. So now there's all sorts of more of this chemical that makes us feel happy and not worry as much. So if we block the right one, we can sit still, pay attention, and get our work done better. So that kind of goes to this second assumption that all we have to do is just fine-tune the action of the chemicals, and that all those chemicals are there and that'll be just fine. That's an assumption that probably looks like typically isn't true. So what is it that's kind of this international sort of issue or thing that's come up? So about a decade and a half ago, physicians in France were looking at all these kids who we were making these assumptions that, oh, all we need to do is just block this little spot right here, and everybody's going to do better with regards to ADD. They're all going to sit still, pay attention, get their work done better. The only problem was is these were kids who were taking these medications and they weren't sitting still, paying attention, and getting their work done better. So they did some blood tests. And what they found out was that 84% of these kids were iron deficient. Well, because iron is part of what helps the body make dopamine, you can block this all you want. If these little bags of chemicals are empty, or they're only half full, basically what's happening is that this brain cell's only spitting out part of what it needs to tell the body to sit still, pay attention, get its work done. So you can give huge doses of this stuff and just kind of block all of them, and you're still not going to get any benefits. Well, the cool thing was, several things happened. A group of physicians in China started taking a look at not only what these physicians did in France, but a number of other studies around the world. And they were like, you know what? It's not just this one study. This is showing up in all sorts of places. And it's all holding true, that this low level of iron stored throughout the body seems to cause these problems with ADD kinds of things. The other thing was that then a group of physicians in Egypt said, well, we wonder if there's other things that could be going on. So they started doing some looking at, all right, well, what do we need to do to make these chemicals that are going to help the brain work better? We need all sorts of nutrients for the brain to work well. So they started doing some other blood tests, and they found that, well, you know what? Certain kinds of ADD or ADHD, you can have lower levels of zinc as well as magnesium, and that seems to mess with things, or a combination of those. It's like, so basically, if we start starving the body, and primarily the brain, because this takes up like 25% of the intake of different nutrients and energy that we need, we can start really messing with how much these are filled up with things or not. And then all of a sudden we can keep giving kids all of these kinds of medications that do just this, but they're not going to work. And then the physicians in France came back and they said, well, you know, that's nice that we're finding this connection, but does it really make a difference? So they took a small group of these kids who they found that were low in iron and had these ADD or ADHD problems, and they treated them with iron. And it wound up working just as well as Ritalin. So it's like, okay, so not only is this lack of certain things leading to difficulties with regards to medicines not working, but if we actually feed the body and replenish what it needs to work well, we can even get things to work just like it would as if we were giving it medication, because we're helping the body make these chemicals and essentially tell the next brain cell, sit still, pay attention, get your work done. So what are we doing every day? So this is where the whole issue with regards to diet and what we're eating and the kinds of foods is important. But let me make it simple. Every day we do something that helps our body sustain or improve its health. We eat. Basically, the reason I go over this is that if someone is lacking iron, let's say, and we correct that, then some individuals are like, they get kind of anxious. They're like, well, you know, my iron's better now, but what if I stop taking it? Well, what's your concern if you stop taking it? Well, is it going to drop back down? And I'm like, well, I don't think we were made where we were supposed to have to take an iron tablet every day. It's something where what should happen is that we should be able to, out of our diet, get enough of these kinds of nutrients that between good diet and good digestion, all of those stay up where they need to be. So what often happens, it's not like most of these individuals, like initially I was like, okay, so I figured, well, let me be a doctor again. Let me start testing individuals to kind of see if maybe this iron thing is a problem. So when I was working in a pediatric office, I started testing individuals to kind of see, all right, does this particular test, it's called ferritin, which tests for the amount of iron throughout the whole body, is this less than it should be? Now, what's less than it should be? So I'll give a little demonstration of this. We do this test called ferritin because neurologists will do this as well. So these are other doctors that look at how the brain is functioning, and they treat adults sometimes who have what we call restless leg syndrome. So these are individuals who, when they're sitting still, their legs feel funny. Might feel numb, or like they got pins and needles or ants crawling on them, or just electric shocks, or all sorts of weird stuff where they feel better when they're moving. Well, neurologists will test this particular test called ferritin, looking at iron storage, and they'll say, you know what, it should be at least above 50, 50. And the reason for that is that because iron helps the body make dopamine that's related to restless leg syndrome, if that is too low, it's basically saying your body doesn't have enough of what it needs to make this chemical, and that could be causing your problem. So we don't need to give you a bunch of prescriptions. We should fix this problem. Well, this is what it looks like when I'm 48. What would it look like if I was 8? I'd look like a fidgety, hyperactive kid. So I figured, okay, this could be important. I should check this out. So when I checked this particular test, and most of these kids, they weren't anemic, didn't have a lack of red blood cells that, you know, made them extremely tired. They were more fidgety than tired many of the times. But 79% of the next 900 kids I tested had a level where a neurologist would say, you could have restless leg syndrome just based on your test. And I was like, and by the way, treating this will cost you about 3 cents a day. And there's more to it than that. I mean, you have to try and get iron into your body well, but here was this problem that was coming up 79% of the time that's a correctable medical condition that could lead to problems with ADD or ADHD. So this whole eating issue, so it's like giving individuals iron. When that got better, that people would get nervous. It's like, oh my gosh, it's going to drop. It's like, no, what should happen is like, you're doing something every day to take care of your health. You're eating. And that's terrific. All of these nutrients should get into the body. The important thing was this, and that speaks to this second thing that's noted there, that what I started learning, it took quite a while, sometimes a little slow on the uptake, was that other than oxygen that gets in through the lungs, and if you happen to live in a climate that has some sunshine, where you get vitamin D through your skin, every other nutrient that gets into our body, especially to feed our brain, but every other part of the body as well, gets in through our digestive tract. So if you have any kind of digestive problem, you basically are going to be in a situation where you can eat a great diet. Parents can be feeding you all the right kinds of things, you're eating all the right stuff, you're doing the best job to try and take care of yourself, and this stuff just doesn't get into your body to help you heal well. Well, it's been recently, and this is kind of an interesting thing, and we'll kind of get to this as we go through some of this stuff, that anything that causes inflammation will lead to difficulties with these nutrients getting into the body. Now that can be very severe inflammation, things like ulcerative colitis, Crohn's disease, severe food allergies, things like celiac disease. But what's a chemical that leads to inflammation in the body naturally? Well, there's a chemical that especially this time of year some of us have a whole lot of fun dealing with, and that's histamine, which is related to allergies. Well, the difficulty with histamine is that it can cause not just, inflammation in our eyes and itchy, watery, runny nose, all that fun stuff, but it may also cause inflammation in our intestines. Why is that important? Well, it turns out if you tend to eat a diet that is mostly processed foods tend to sit for a while. Foods that tend to sit for a while and ferment have their histamine levels go up. So if you tend to eat a diet that is basically less processed food and more fresh food, you likely have a greater likelihood, maybe because of this particular chemical, of having less inflammation. So some people, it's like, why do individuals who move, say, from Japan, China, India, other places, and have a diet that isn't this processed food, within a couple of generations have to start having all of these problems that come up with regards to American healthcare? Well, here's the thing. So my brother and his wife are traveling in Spain, in Portugal, and she's from China, and they're going around getting all these fresh foods and terrific meals, and she says, the food here is just like at home. And my brother looks at her like, we're in Spain, you're from China, that doesn't make any sense. And she goes, no, everything here is fresh. Everything here just came from the market. It isn't packaged and wrapped up and it's got to have a stamp on it, says don't eat it after this date because then it sat for 3 weeks. That everything is fresh. So that may have, just in terms of this whole issue with regards to diet and everything, that if we do anything or if we're exposed to things that mess with our digestion, you could be doing exactly the right things, but it's completely messing with things that lead to attention problems. So, all right, can we really change things with regards to diet? 2 severe illnesses that we're aware of that for some individuals can be dramatically improved with diet, often exercise, but stabilized without medications: heart disease and diabetes. Significant killers for both men and women. Nutrient insufficiencies. Okay, so what did individuals in these different countries find? So individuals in France finding that iron being too low causes a problem. Now, why would that happen? It's like, are they anemic? No, most of them aren't. Are they tired? Not necessarily. They're hyper and they're dancing around in class sometimes. But how would that lead to attention problems? Well, if we go back to this, these chemicals just don't show up in here magically. It's like, ta-da, they're all packaged, here we go. The body has to do things to manufacture them. So let's say that this little triangle here is dopamine. Okay, well, how do we make that? Well, we need certain ingredients. There's an amino acid called tyrosine. It has to turn into dopamine somehow. Well, how does that happen? Well, we have little, what are called enzymes, proteins in the body that manufacture stuff out of ingredients. And the enzyme, or the protein that does that, needs iron to work well. So if you don't have enough iron, it's sort of like it's not working very well. And they can't make this little triangle to go out here and work. So you can give all these medicines here, blocking all sorts of things, but your body just isn't making it. So you want to make sure that you have enough, basically, of this iron as part of the machinery to manufacture this particular thing. What about zinc? Okay. And then what was found, what I came across was that I started measuring zinc levels. Found that this was an issue with regards to ADD as well. Well, part of what we're also assuming with this model here is that these little bags of chemicals, that little triangle inside that circle there, just comes out and kind of pops out of that first brain cell, goes over to the next one, and it just does that automatically, and no particular reason. Well, you need certain things to tell your body to send that little chemical out into this space here. Part of what's needed is insulin. Insulin actually helps this little circle come out here and pop out so it can go over and send the message. Well, it turns out that part of what zinc does is that it helps with the production, storage, and release of insulin. So it's like, oh, that seems rather important. So not just do we need to release, not we need to not only have this chemical go out here, we need to make sure it can pop out here, and that it's actually getting manufactured in the first place. Now, why would that be important? Well, if we think about things other than ADD, other brain-related conditions like memory, one of the things that individuals will consider certain kinds of dementia, like maybe even Alzheimer's, is a type 3 diabetes, where maybe it's the whole issue with regards to insulin and insulin resistance is causing problems with regards to how the brain is working. Okay, so this insulin thing is kind of coming up in a few different ways in terms of not being forgetful, having good attention span, all those kinds of things. So what may be going on here with zinc is that it's helping the body not necessarily make these chemicals, it's actually helping them get out so they can do their job. So if you're really low in zinc, let's say you got plenty of iron, but you're low in zinc, it's like, well, you got all these bags of chemicals all full, but they're not getting anywhere to really do your brain any good. What about magnesium? Okay, well, that's when we can use this scan over here, and I'll kind of walk over and you guys can look at this here with me. That this red, white, and blue scan here, I'll bring it over so that I'm back on camera here. There's red, white, and blue scan. Now, what we would like to see, this is kind of looking at the inside of the brain and how it's functioning. This bottom part here is in what's called the cerebellum. It's back at the back of the brain, kind of here down a bit. This helps with muscle coordination and balance. This we'd like to see working, because if it's not, I would be falling on the floor on a regular basis. Very hard to give a presentation or talk with you guys. And I'd get injured a lot. So this should be working. It's always supposed to kind of be helping us so we're not swaying around and banging into things. The rest of the brain we'd like to see kind of more relaxed. Now, this is not a very relaxed brain. I know the person who had this scan, and this person, very intelligent, really on top of things, sharp as a tack, but didn't have a brain that relaxed very well. So then we say, okay, well, what would that look like if we had attention problems? Well, some kids, it could be that maybe part of what happens is the frontal lobe doesn't work well, so they can't focus, pay attention, concentrate, they're daydreamy, those kinds of things. And they get distracted by everything going on around them. What I started to learn to ask as I was working here was, well, do you get distracted by everything going on around you? Or do you get distracted by how much stuff is going on inside your head? And some individuals were like, oh, yeah, I'm usually distracted by all the things I'm thinking about, especially if I got a really boring assignment. So it's like, I know I should get this assignment done. It shouldn't take that long when I get started. But man, this is boring. And I've got 20 different things I'm thinking about inside my head right now. So it's kind of like 18 of those are a whole lot more entertaining to think about than this assignment right here. So it's probably going to take me about 2 hours to get this half-hour assignment done. So individuals can have these problems with attention, not so much if they've got a brain that's underactive. It's sort of like it's overactive. So these are kids who are like, their brain's in hyperdrive. What else might they describe? They might describe, you know what? When I start to get a few assignments, even though I get A's as grades, I start to feel like there's too much stuff going on and I'm starting to get overwhelmed. And I can't do this. And parents are looking at them like, what the crud are you talking about? What do you mean you can't do this? You're in honors level courses. You've been smart for years. You get A's as grade in honors level classes that, you know, clearly you can do this. It's just a math assignment. You do great in this. It's like, no, I can't do this. It's too much. And, you know, parents are pulling their hair out and kids are like stressing and everybody gets wigged out and then it turns out to be a real fun evening at that point. So for some individuals, it's not that we want to even give them a stimulant then. If we're looking at medications, it's like, oh, how can we effectively really wind the brain up harder? That is sort of like, okay, you've already got the accelerator stomped to the floor. Let's add a stimulant. That's why it's like, okay, this ring of fire sort of thing, that's not a good idea. So, magnesium can be especially important for individuals who have an overly active brain. Now, what's kind of the even more recent stuff? So, usually by the time I kind of figure this stuff out, I'm thinking, oh, I'm pretty hot stuff. I got this thing figured out. I got it nailed. You know, it's like, all right, okay. Here's all these different symptoms. I know kind of what can go on with these brain scans. I got ADD things figured out from the standpoint of what's going on with these brain cells, with the chemicals, how diet's involved, all this kind of stuff. And it's usually when I start thinking that I got things figured out that something's going to happen or I'm going to get shot down. So that's exactly what happened next. So had these kids come in, starting about 1.5 years ago. Intelligent, typically guys. Women intelligent as well, but these were the guys who had the real problems because they came in and I said, well, what's going on? And I'd seen these kids for a while, and their parents would say, well, our child's smart, yeah. They're on stimulants, it's like, yeah, and they help with attention, yeah. Still in honors level classes, yeah. Well, what's going on? We can't get them to do anything. Nothing. We've taken away their iPod, their video games, their Skype. They can't talk on their phone with their friends. They can't go on and play video, limited everything. They're still procrastinating and it's driving us nuts. So I figured, okay, well, I'm thinking about all this science and all this stuff. I'm listening to the families, what's going on and how it's driving them crazy. And I'm thinking about, okay, what's going on chemically? So I think, okay, I already knew some of these guys were low in zinc. Now what's supposed to happen is between zinc and copper, these are usually in balance. So if zinc becomes low, copper becomes high. And I already knew that copper was something that could be toxic to the brain. So I figured, here's what I'm going to predict. I'm going to zinc test back, copper test back. This can be low, this can be high. I knew exactly what was going on. I'll have predicted it. I'll look so smart. Didn't turn out that way. Both of them came back low. And I'm like, all right. Well, this is a perfect opportunity to learn more about the human body that I thought I had figured out, but didn't. So, one of these chemicals, this little triangle here, is dopamine. There's a little square here, let's say that that's adrenaline. Well, part of what copper does, just like we need something to help us make dopamine, we need something to help us make adrenaline. That's part of what copper does. So then I was like, oh, and it took me a little while to figure this out. It wasn't like in the same visit, that day I'm like, oh, I got this all figured out. It was after I was like seeing a few individuals who came back with these tests, and I'm like, all right, I really look like a dork now. None of this is fitting. And I was like, okay, so what would it look like if you're a parent of a child who might have both low iron and low copper? Well, if copper helps us make this adrenaline as sort of that get up and go chemical, it'd be sort of like our get up and go had got up and went. So let's say somebody gets a 4-week assignment. Well, weeks 1 through 3, this person's sitting on the couch because they don't have the drive to get up and get started. They're like, it's not all that much fun. So if it's a class that they're not that excited about, or if it's a teacher that's not all that enthralling, or a subject that's like, weeks 1 through 3 are sitting on the couch. So what happens at week 4? Well, that's when these individuals, their buddies or girlfriends were like, oh man, you should have started on that like 2 weeks ago. Their teachers are like, you probably should have started on that 3 weeks ago. And the parents are like, you should have started on that 3.5 weeks ago. So at this point, now the adrenaline starts going up. The stress level starts climbing. And because they can't get rid of adrenaline well, which is the other thing that iron does, they reach this peak and they get stressed and shut down. So what parents get to see is either they're sitting on the couch weeks 1 through 3 because they have no drive to get started, or they're sitting on the couch in week 4 because now they're so overwhelmed they have no idea where to start to get it done. So what parents see is, you sat on the couch for a month. And what's going on inside are kind of different stories depending on the time of when everything's occurring. Now some people, they're adrenaline junkies. If they're smart, they wait until the night before, they can crank out a 10-page paper. They do it well because all of a sudden their adrenaline is just pumping through their veins. So they're up till 2 in the morning, they crank out this paper, they turn it in, they get a good grade, and they're like, see, I could have done it. Meanwhile, parents have lost half their hair. The dog is scared. Everybody is pissed off. And the kid's like, why are you guys all bent out of shape? Things are fine. Or it's like the end of a semester. And everyone is like, how are you going to do 8 weeks of work in 2 days? And the kids are like, why are you on my case? why are you so upset with me? Why are you not telling me that I've done a good job of getting that one chapter done? Because you got 72 more to do. But that's what will happen. And it's this, and I've seen it over and over, and I'm like, oh my gosh. It is not a relaxing circumstance for families. So this getting out of balance, I started to realize, man, this can really screw things up. And then I started looking at, you know what? Copper is also part of what helps our body get rid of histamine. So I'm like, oh, so let's see. Let's take somebody, put them here in the United States, give them a processed food diet, and basically set up a biologic condition where they don't have much motivation. So this is the kind of person that not only is going to have low motivation to get started, they're going to get stressed out and overwhelmed. So it's like these are individuals who maybe at age of 25 don't move out of the house. They're like, I know I should get going on things, but I don't know how to get started. I don't have the drive to get started. And whenever I try and do something, like try and go out and apply for a job, it feels so overwhelming, I don't know how to do it. Kind of this whole failure to launch kind of thing. So it encompasses not just ADD kinds of things, but all sorts of difficulties that this can create in terms of not just attention, but task completion, or even getting started on things. So I had a mom come in last week, and she said, but we've been seeing a naturopath. We've been talking with a doctor who's familiar with all this stuff. This is what we've been doing for a long time. And she goes, oh, you know what? Maybe it's this thing where we're kind of doing different things at different times, and we need sort of, it's a symphony of things, that we need all of this to kind of come together at one point. We need like all of the different parts of this orchestra to work well together, which made sense. And then I started feeling like, oh, I'm the conductor. It took me a few days to realize, okay, no, I'm just going to get screwed up again when I start thinking that I got all this figured out. One of the big things, and this was in the thing that we talked about when I did this last month, is that if you live here and don't get much sunshine and your vitamin D level gets low, it can mess with the majority of these things. Also turns out, I started doing histamine tests on individuals, had a couple come back, and I was thinking, oh, here's what's going to happen. Of course, I was wrong. But the thing I noticed was like, okay, well, here's someone's whole blood histamine level, and here's another person's, and this one was kind of lower, and this one was a bit higher. And what I noticed on those test results for these two people, so I still have to find out if this is going to hold true or not, is that this higher level of histamine came with someone who had very low levels of vitamin D. And this lower level of histamine, this person had boatloads of vitamin D. So I wonder if I could find anything in the medical scientific literature that would indicate maybe that goes on. So then I find that there's this condition called urticaria, where you have all this itching and hives and stuff, and kind of a lot of histamine sorts of things. Vitamin D helps it get better. So I'm like, great. I need sunshine. So I'm working really hard to get insurance companies to pay for trips to Hawaii, but it hasn't worked yet. But this whole issue of it, it's basically that if we feed our body the right things, that makes all the difference in terms of things working well. Now, nice theory. So what I did is, since I gave this last presentation, I said, okay, let me take the kids that I've evaluated, so they've come in as new patients here, and have had not only a diagnosis of ADD, or ADHD, or hyperactivity, or different things, but what have their tests shown? So I put these results up here. So we've got a 15-year-old young gentleman, has ADHD, this combined type, not just the attention issues. If we're looking at the scans, type 6, which is this ring of fire, kind of this sort of brain pattern that we see up here on the wall that I was showing you. And he's also on an antidepressant, very high dose. That's pretty much the maximum dose of this particular antidepressant. Still severely depressed, still problems with the ADD and ADHD. Well, his vitamin D was not only low, the reason it's in red is that if a doctor looked at this and got the results from the lab, it would have that little L next to it, where it's actually low enough that his body is medically deficient. Now, kind of a way to think of it is like, medically deficient is your whole bloody body is lower than this than it should be to function well. This ferritin, because it should be at least above 50, it didn't have that little L next to it on these results, but it's low enough that it's insufficient for the brain to have what it needs to work well. So I'm concerned about both of those guys. Well, both of these, this zinc and copper should probably both be up around 100 to really optimize things. So he's really at a spot where all 4 of these nutrients that his body needs sucked. So he was one of these guys where it was like, at least when I talked with him recently, he had about 4 more days to take care of probably 12 hours of community service and all sorts of other assignments. And it was like his dad was doing his best to just kind of relax and kind of take it easy and not wig out about how much work he had to do. And he was kind of like, I'll get it done, Dad. And this is where Mom and Dad are like, I'm coming unglued. Next person, 10-year-old young man, ADD. So he had difficulties, kind of Dr. Amen, that usually it doesn't come out with someone having problems with ADD or ADHD. It's like neat that, oh, it's type 3 or it's type 4 or it's, type 7. It's often kind of a mixture of those. Taking a multivitamin, his vitamin D really sucked. I mean, this is, like in my mind, critically low. Now, why is that? Because for good brain functioning, our vitamin D should probably be at least above 40. Probably best if it's up around 80. Still in the normal range, but up at the higher end. This was incredibly low, where it could be messing with the degree of motivation and concentration and memory issues for anybody, any age. This person, 27-year-old woman, not only was her iron lower than it should be, this iron storage, she's actually medically deficient in zinc. And why is that important? Well, zinc is involved in 200 different chemical reactions in the body. Not just this whole issue of how well these chemicals get released within the brain, but it helps with making thyroid hormone, which she was underactive in, helps with making insulin, helps with making testosterone, that both for men and women gets converted into, well, for women gets converted into estradiol. So all sorts of hormones can get totally out of whack if we're low in zinc. Now, she was not just low, but medically deficient. What have I seen happen when someone goes in and they have a test that shows that a person is medically deficient in zinc? So, went in with a family member. They presented this to their doctor, and they said, well, you should go see a naturopath. And I'm like, is that what we do as doctors? If we find that somebody is medically deficient in something, we say, you should go see somebody else to get you vitamins? But that's exactly what happened. It wasn't like, gee, this might seem like it would be an important thing. It's basically, okay, what I've gradually learned is that it's more typical than not that if you see a medically trained physician, they're trained to prescribe. Part of that is that we're not trained to do other things. Either we learn to do that on our own, or we learn from other individuals, but certain individuals, doctors of osteopathy, naturopaths, individuals in homeopathy, they look at, okay, what can we do to feed the body well? Physicians aren't trained that way. That's not what we're taught. We're taught, okay, if you get a blood test done and you're not anemic, what we usually tell people is, your iron's fine. Most of the case, that's not true. Your iron might be good enough to make red blood cells, but it's not enough to feed other parts of your body, like potentially your brain well. So here's another person, 21-year-old, who also, in addition to this ADD, like this person up here, has had difficulties with regards to motivation and drive. And it's like, okay, vitamin D is lower than it should be, but there's no little L on the paper next to it. Iron storage is less than 50, less than it should be. This zinc and copper are both below 100, and it's like, oh man. So he's basically got this quadruple whammy, where it's like for this 21-year-old, okay, this would be the kind of person that's like, I'm 21, I can't seem to get a job done well, can't seem to stay in a job, I keep getting laid off of jobs because I can't get things done on time, I'm disorganized, I show up to work late, I can't move out of my parents' house, and it's just not working. It's like, well, yeah, you know what, if I basically made anybody have these kinds of numbers, it would really mess with how anybody would function. So as I gather more information, that I can kind of update this on a regular basis, and one of the things that I'll be talking about, I think it's in a couple of months, maybe 3 months or so, that Dr. Chapik will be doing this coming up, and Dr. Amen will be here next month, is it'll be talking about how these same things can relate to things that we call sensory integration disorder or sensory processing disorder. Fascinating thing is that as I started asking kids about those kinds of issues, and they started describing, you know what, yeah, you know what, I got all these sensitive, I hate tags, that, you know, if my shoes or socks don't fit just right, it drives me nuts. Tags make me itchy, or I can't wear jeans. The vast majority of those kids were iron deficient. So these can have an indication as to what might be going on medically with a number of things. So in summary, and then I want to see, you know, any questions you've got, but I also want to finish up by 6, so if you guys want to go out and hang out in the sunshine, you got a chance to do that. We get a lot of information about you need to eat the right things. Here's the option. How best to say this in a very politic sort of way? There's a much greater risk of dying from starving than there is eating the wrong food. Not that I want us to eat all bad things, but if you're faced with the choice of either eating something at one particular point in time that isn't all that good for you, and that's your only option because you're on the run and you have to eat something, eat. Then our brain uses 25% of the calories and things that we take in. 25% of 0 is still 0. Getting something to eat can dramatically help, so at least we're getting something. The other thing that this does is that every once in a while, if unintentionally, accidentally, you just can't help it, you eat something that may not be all that good for you, it's amazing how much that motivates us to eat right. That I've had individuals, family member, you know, young guy, he says, you know, it used to be I'd go out, I could run like crazy, I could be doing all sorts of things, I'd go to McDonald's, I'd eat this stuff, and it was like, it was all garbage and fat and processed junk, and I'd be like, well, I could still keep going, I'd chug a Mountain Dew, and I was good. He says, now that I've been eating healthy, it's like, I realized how I don't fit into my uniform as well if I'm eating that way. And when he said, I've been eating healthy for a while, and I went back and had that just because we like been moving, and we didn't have any in the kitchen, you know, everything's boxed up. I went out and grabbed something like that. I felt like garbage. And it is really motivating. It's like, yeah, you can have a parent going, that's not good for you to eat. And it's like, oh, yeah, well, blah, blah, blah. But it really hits home when we do something for ourselves and we're like, that didn't feel so good. And that can be a great reminder. So part of that is not just, I want you to not get 0 calories, but it also is a good educational opportunity. It's a learning experience, much like when I make mistakes, and it's like, okay, that hit home with me. That kind of thing can be great. If you're concerned about your attention and task completion and how well that's working or not working, tell the person that helps to take care of you and keep doing so until they listen. So you don't have to walk out of a person's office or have your family member do that and they say, well, we did the test and it doesn't say you have ADD. Well, what is going on? Well, you don't have ADD. Well, what is causing my problem? It's like you want to go to somebody who's listening and who can say, okay, I'm hearing you got a problem. I don't know what's causing it, but let's figure it out. Finally, we don't know why is not acceptable. Now, not saying that I've got all the answers, but I should be working on understanding things like how the brain works, what these chemicals do, even, you know, in another year, be able to stand up here and say, here's what more I've learned, so that those individuals that I didn't have answers for, I looked hard enough to find answers. So I don't know why, from someone who's trying to help you with this, is not an okay answer to be left with, at least. It should be, at its worst, is I don't know why, let's see what we can figure out.